Hello, Namaste. My name is Dr. Sudhir, and I am a consultant in pain management in Hariom Specialty Healthcare Center, Tirupati. And I have done my MBBS, Diploma Anesthesia, DNB Anesthesia, and I have done my fellowship in pain medicine and pain management in cancer patients. As you can see here in the slide, contact details of the hospital and location in Tirupati and website details, email, my personal email ID. Kindly feel free to contact me, mail me regarding any of your issues. We can discuss over mail also, and a video consultation you can do through WhatsApp and various other formats, and we can book through Liberate, Qfroy also, and social media. You can see here in all these formats we are there, and we keep uploading our playlist videos in Hariom Specialty Healthcare Center is the search which you have to do in YouTube, and most of the videos are also uploaded in Facebook, LinkedIn, WhatsApp, and Instagram and Twitter also. Telegram also there is Hariom Specialty Pain Healthcare Center. It's there, and we can chat there also regarding your conditions. Okay, now we have come to a stage where the first two stages of medication and restorative therapies have been tried for the patient, and still patient is having a pain score between 6 to 7, or pain is still present, or the patient is having acute pain or chronic pain and it is not decreased with the first two steps. Then we have the option of interventional procedures. Now, in interventional procedures, what is it? Interventional pain management. Now it is called as interventional pain medicine itself. It has become a separate, different branch, and we do provide most of the procedures in interventional procedures for pain management. It has become a subspecialty, and wherein minimally invasive procedures are done to decrease the pain and minimize the oral medications which are taken. Uh, Previously, it was image guided procedures were less. Now, this is the golden rule. Almost the golden rule is image guided intervention procedures, either using ultrasound, fluoroscopy, computer CT scan. This shows a great benefit in assessment and treatment plans for the patient. It can be diagnostic and therapeutic also. Interventional pain management only for first diagnosis also it can be given, or the initial injection is given to see the effectiveness of this particular intervention for a patient, and therapeutic. Okay, and many procedures are there which can be done in only plain outpatient basis, and just monitor the patient for some time. And the best thing is it is cost effective care for the patient. Some of the procedures are there which require primary hospital care setting to be present for a little bit more time, for or 1 day observation or like that for the patient, and monitoring certain conditions, and patients with some comorbid conditions who have been given interventional procedures like that. And there are certain advanced procedures which require special instruments and a team uh, for doing the procedure. This requires to be done in a higher center. Okay, now these are all the different types. It's still compressed type, very less. As you can see, the red zone is a little bit complex procedures. The yellow is intermediate, and the top one, green one, is mild procedures, simple procedures. Now, trigger point injections, joint injections, peripheral nerve injections, blocks also, So these are all comes under simple injections for the patients with different diseases who require either diagnostic or therapeutic. Now, facet joint nerve blocks, epidural steroids, radio frequency ablations, regenerative therapy injections, celiac plexus blocks, cryoneuro and celiac plexus blocks and lumbar plexus blocks are used in cancer patients, and it gives amazing results. uh, they can be done in primary health care settings, and for some patients it requires higher centers. Now, spinal cord stimulator, intrathecal pain pumps, and epidural adhesiolysis, vertebral augmentation. Now, these are the procedures for which you require a higher center, a super specialty center, wherein a team of doctors are required, and anesthetist also is required for monitoring the patient and so that the procedure goes well. Now, these are all again. I have compiled the most common things which are done intervention procedures: trigeminal nerve injection, fluoroscopy based, glossopharyngeal nerve injection, post-herpetic neuralgia nerve blocks, and joint injections, any of the major joints, plantar fasciitis, spinal facet nerve block. These are all most common injections. You can see ozone also here. I'll tell you that later on. Epidural steroid most commonly given usually for back pain and radicular pain, and transforaminal epidural steroid and selective nerve root injections are types of epidural steroid injection. Facet joint nerve block in the spine and denervation injection. It is done under fluoroscopy, so fluoroscopy guided procedures for facet related spine pain, and it's primarily diagnostic. And after diagnostic injection, we can plan and do a therapeutic procedure for the same injection and give a long-term relief for the patient. And radiofrequency ablation can be planned in the same area later on, or cryoneuroablation can be done. As you can see, cryoneuroablation, also called as cryoanalgesia, you can think it as, or cryoneurolysis. Okay. Now, this is a specialized interventional technique using cryoprobe. Now, cryoprobe freezes sensory nerves. Okay, for long-term pain relief. It literally decreases the temperature at that point and gives kind of a shock to the nerves. Now, you most effective in all these conditions: trigeminal neuralgia patients, chest wall pain patients, phantom limb, peripheral neuropathy, knee osteoarthritis patients, and radiofrequency ablation. See, most commonly used two types there: conventional radiofrequency ablation was there, and pulse radiofrequency ablation is the current one, which is used in most of the conditions. This is a type of therapy in which you use needles which are inserted next to the nerves, just beside the nerves, and you give voltage uh, in different formats, either conventionally or pulse format. In pulse format, you give short high voltage bursts, and suddenly you stun the nerves and blocks the transmission of pain signals, and usually it's for quite long time, and this decreases the pain for the patient, and suddenly patient will feel very happy about that, and he'll have such a good relief. And usually radicular pain in the spine, it is used, and cancer patients also it plays a very much promising role. And peripheral nerve injections or peripheral nerve blocks, these are nothing but injections of local anesthetics mixed with anti-inflammatory steroid injections, or you can give clonidine also, which is one of the anesthetic drugs for both diagnostic and therapeutic pain relief. It's a single injection and usually single injection, or can be given as a infusion also using catheters which are inserted in the spine. That is there in the next therapy. Now it is used for chronic pain syndrome, CRPS, headaches, pelvic pain, sciatica. Now nowadays ultrasound is used in order to give peripheral nerve blocks, and it has become very common to use ultrasounds. Now, sympathetic nerve blocks. In this, you give local anesthesia to sympathetic nerve chain in the nervous system, and to diagnose or treat any condition which involves sympathetic nerves, uh, and to treat neuropathic pain. And you can see here complex regional pain syndrome, in which sympathetic nerve system is involved, type 1 and type 2, and chronic abdominal pelvic or perineal pain. Cancer patients also it is very used because they have all these things. Neuromodulation, you modulate things here. It's a device based electrical or magnetic stimulation to activate central and peripheral nerve system tissue associated with pain pathways, and it produces analgesia or reduces sensitivity to the pain. It is most commonly having a variety of waveforms and frequencies, and dorsal root ganglion stimulation is usually done. Peripheral nerve stimulation has got its reputation increased because, and it recognition of peripheral nerve entrapments and increased use of ultrasounds is one of the implementing technologies for giving neuromodulation techniques. And recently, non-invasive neuromodulation therapy is being studied for headache disorders, and non-invasive vagus nerve stimulation for cluster headaches, migraines. Intrathecal medication pumps. These intrathecal medication pumps are implanted pumps where a catheter is passed to the spinal fluid, and medication is given continuously. Uh, it is used most commonly for cancer pain, and lesser in non-cancer patients. Should be a very chronic pain patients, and usually in acute patients also post-operatively we do give this intrathecal medication pumps. Significant side effects will be present, say for example delayed respiratory depression, granuloma formation, opioid induced hypogonadism. Now, vertebral augmentation, it stabilizes spine, usually done for vertebral compression fractures. Okay. Trigger point injections, the trigger points as such are called palpable tense bands of skeletal muscle fibers that on compression produces local pain or referred pain. Now, dry needling or injection of local anesthesia is done, which gives a pain relief in that point of trigger points. Used for headaches, myofascial pain syndrome, and low back pain. Now, other types of direct injections like this is given intramuscular, intrabursal, intra-articular for muscle pain, bursitis, joint pain respectively. Okay. Now joint injections, as the name tells, shoulder, elbow, wrist, knee, ankle, has got very good effect when there is inflammatory arthritis, basal joint arthritis, and to treat joint pain resulting from injury, and diagnostically source of the joint pain can be found out. And interspinous process spacer devices. Okay, you just I'm sure these are all very recent ones and not so common. Now this is becoming common, or almost done by most of the doctors. Regenerative therapy is called as you regenerate the type of tissue which has got damaged, say for example cartilage. Okay, so you take there are different types in which you have platelets rich plasma PRP therapy, autologous stem cell therapy, and under this also various ways are there in which it is given. All you have to know is it is very much promising therapy in the treatment of multiple painful conditions. Okay. Regarding autologous stem cell therapy, research is still going on, whereas platelet-rich plasma therapy has been found to be greatly effective. Now, ozone therapy, I was discussing, I told you already, intra-articular it is given, and it has very good effect in decreasing chronic pain. See, this ozone uh, means O3 molecule, oxygen is O2. So, O3 molecule has got very good effect against inflammatory markers and inflammatory conditions, and so it gives immediate relief for the patient, and very good relief. But because of it, one of the side effects which is very important, which is embolism, FDA has banned it, or rather still it is inquiry in US, but it is in widespread use by many pain physicians, and it has got its advantages. So we are done with interventional pain management, which is one of my specialization of pain management techniques. And you can see again contact number. You can call me the second number, and you can contact me WhatsApp calls, and the address is here, website, email, kindly email, and we can get into know each other and discuss about your condition. And even in all the social media platforms we'll be updating our videos and our discussions, and certain webinars we'll be conducting, and as such in YouTube videos will be uploaded, Telegram it will be uploaded. Okay, fine. Nice. We'll see in the next video what is the next type of therapy for pain management. Okay, fine. Bye bye.